Some promising news for people with blocked arteries that could lead to gangrene or amputation of their feet or legs.
Even better, some patients may actually begin to feel sensation in their prosthetic hands. CBS 2's Dr. Max Gomez explains these important developments. Doc.
That's right, Maurice and Christine. You know, the same atherosclerosis or hardening of the arteries that leads to heart attacks is also blocking arteries all over the body. When it gets bad in the legs, it can cause tremendous pain and could even lead to amputation from lack of blood flow. Here's a balloon to fix that problem. This is Brian Barrett doing what he sort of loves to do, yard work at his New Jersey home. But last year, even a little bit of walking was causing serious leg pain in the 66-year-old.
It was the calf muscles were cramping to a point that it hurt that I couldn't walk.
An ultrasound of Brian's legs revealed that he had PAD, peripheral artery disease, that was blocking blood flow to his legs.
PAD in general, it causes amputation at about 90% of all amputations.
When conservative therapy, including medications, fail, the next step is often a minimally invasive procedure to use a larger version of the type of balloons that open up heart arteries. Trouble is, stents that keep heart arteries open tend to break in the legs, which means
the reblockages were very, very high, so our procedures had to be repeatedly performed on the patients for symptomatic relief.
So Brian became the first patient in the U.S. to have his leg arteries opened with a different type of balloon after it was approved by the FDA. It's called Lutonix, and the key difference is that in addition to opening the artery, the balloon also releases a drug that prevents scar tissue from reblocking the artery.
A year from now, you check, 75% of those arteries are open, which is a tremendous leap as compared to plain old balloon, which is what we've been using.
Unfortunately, I can go out and rake the leaves for more than 10 minutes at a time.
But despite the best treatments, some patients still end up with amputations, often because of trauma. Now the Defense Department's Advanced Research Projects Agency has implanted electrodes in the brain of a patient like this one. One set lets him move a prosthetic hand with his thoughts, and the other electrodes actually give him feeling from his hand. Highly experimental, but a huge step forward. Now, that sensory feedback from a prosthetic hand is key to allow a patient to touch and grip something like an egg or a child's hand with just the right amount of pressure. Not to mention that it makes a motorized hand actually feel like his own hand. Now, this is still very, very early, but sooner or later that prosthetic hand is probably going to feel almost like your own hand.
Incredible.
Yeah, it really is.
All right.
Thank you, Dr. Max.